So I take care of a unique population of patients at the University of Michigan with Thoracic Outlet Syndrome. That's a syndrome where young, otherwise healthy people frequently have compression of their nerves, their artery or vein between their clavicle and first rib. Since I've come here, I've been able to form a multidisciplinary program and become a leading provider for that in our state. I've found great satisfaction in it because I've been able to return a lot of young people back to school, back to sports, and young adults back to work and productive lives. We've been able to form research programs around it, and we've been able to build an entire multidisciplinary team that has taken off on their own tangents about how to improve that patient's care. What made me decide to become a physician? At its core, the basic idea was I wanted to be able to take care of people and help people get through the illnesses in their lives back to a healthy life. Along the way, that evolved into working on innovation projects and working in areas that other people didn't work in to get younger people and athletes back to their lives. One of the most exciting things about vascular surgery right now is that we're going to have a continued evolution in endovascular therapy. So we're going to have more complex endografts available to treat the thoracic and thoracoabdominal aorta that will greatly reduce the patient's hospital stay, length of visit, and their complications.